Good afternoon, and thank you for joining this panel on the Caregiving Crisis in COVID-19, sponsored by the Women's Place. I'm Andrea Williams, the Interim Director of the Women's Place and Associate Professor of English here at Ohio State. The Women's Place is committed to supporting women's advancement and gender equity. We offer programming that is available to people of all genders with the belief that what benefits women actually enriches our whole campus community. We're pleased today also to be co-hosted and co-sponsored by the President and Provost Council on Women. You can visit the Women's Place website to find out both more about PPCW and about the Women's Place. Now, for our session today, we recognize that for many people, the disruptions of COVID-19 and the stay-at-home period have disproportionately impacted women, exposing the insecure safety net available to vulnerable families. This day, we want to take time to think about people who are caregivers for children, elders, and special need individuals, and who are dealing with the challenges of trying to thrive both at work and at home. We have a great group of panelists here for you today to help us think about these dilemmas and the resources that Ohio State and places elsewhere here in Central Ohio can make available to women, parents of all generations and genders, and families. So let me introduce our panelists for today. Our first speaker today to be joining us is Noelle Arnold. Noelle Arnold is the Associate Professor for Equity, Diversity, and Global Engagement in the College of Education and Human Ecology. She's a former principal and state-level administrator. She has consulted with districts throughout the United States on crisis leadership, cultural mediation, and teaching and leading in rural and urban settings. Joyce Chen is Associate Professor in Agricultural, Environmental, and Development Economics. Her interests are in development and labor economics, specifically migration and human capital. Her research focuses on the complex relationships between migration, climate change, economic development, and gender. She is also the chair-elect of the President and Provost Council on Women, our co-sponsor for today. Laura Justice is the Distinguished Professor of Educational Psychology in the College of Education and Human Ecology. She's also the Executive Director of the Crane Center for Early Childhood Research and Policy and the Schomburg Family Center. Justice conducts research on early childhood programming, child development and disabilities, and parenting interventions. She's the editor-in-chief of the journal Early Childhood Research Quarterly. Kelsey LaShawn is counselor and elder care specialist for Impact Solutions on behalf today here of Ohio State Employee Assistance Program. She's a counselor and coach who specializes in helping individuals navigate the resources and demands of elder care. She's the president of the Elder Care Professionals of Ohio and serves throughout Northern Ohio, including in Cuyahoga Valley, to address issues of aging. She offers consultations to Ohio State employees throughout the university's Employee Assistance Program. And our last speaker to join us today is John Marshhausen, who is the superintendent of Hilliard City Schools, and also the superintendent in residence in the College of Education and Human Ecology here at OSU. In this role, he serves as a conduit between the K-12 education community and college faculty. He also serves on Governor DeWine's executive board for the Office of Workforce Transformation for the state. Thank all of you for being with us today. And thank all of you for joining us from home or wherever you may be. I want to share that this session is being live captioned and is being recorded and will be made available for you later for viewing. Please also enter your questions through the question and answer function. I will aim to integrate those questions throughout our conversation, as well as reserve time at the end of our conversation to be able to respond to those. So let's get into our topic and think about why we're actually referring to this as a bit of a crisis during COVID-19. Within weeks of the stay-at-home orders being put in place, national media venues were starting to recognize the kinds of ways that the responses to coronavirus would inevitably impact women, perhaps setting them back by some projections as many as several decades in thinking about their unemployment rates and the difficult work that they would take on in their home environments. Headlines began worrying about whether coronavirus would impede the progress that women have made professionally as well as economically, especially for Black women and other women of color. Here, the Women's Place also conducted its own university survey to be able to think about the ways that coronavirus was impacting faculty and staff on campus. And we see from that that many women felt as though their work was being impacted and that they had less time both for research and creative endeavors among faculty and to be able to complete projects that they enjoyed or were assigned as staff. And so in these ways, today's conversation allows for us to be able to think about how people might respond to what ends up being a rather dire circumstance for a number of families across our nation. We know that even before this happened, even before there was a pandemic, it had largely been the case that women would bear more of the responsibility for taking care of others, whether children or elders in their lives. And so let's start by thinking a little bit about what have been the consequences for them economically, as well as in terms of women's well-being, especially now as people are spending time often 24/7 with their own families or loved ones. Joyce, would you mind joining us by talking a bit about how you see the impact of these kinds of caregiving responsibilities influencing women's outcomes?
Yes, thanks so much for having me. I think throughout history, we've seen caregiving responsibilities disproportionately affect women, and that's evident in their labor market outcomes. They're less likely to be in the workforce. They may look for more flexible work opportunities, part-time jobs. They may turn down opportunities for growth and promotion because of the time commitments. And then certainly in fields where you have sort of discrete bars that you have to pass, right? Completing a residency, making partner at a law firm, getting tenure at a university. Those are all much harder for women to hit because of the timeframes that coincide with childbearing and caregiving years in particular. So with COVID, what's really interesting, and I'll share a tweet thread that really resonated with me recently. An economist, Martha Gimbel, notes that, collectively as a society, we've never really addressed these disparities in caregiving responsibilities. What we did was find new ways to monetize them, right? You hire a cleaning service, you get meals delivered, you hire a nanny or use a daycare, right? And so we never actually fundamentally addressed the gender imbalance. And so when we had to remove all of those market opportunities to fix this challenge for women, right now, all of a sudden we find that we have no tools left to help us, right? On top of the fact that we have essentially been passing off a lot of these caregiving duties to marginalized workers as well, right, who are oftentimes underpaid, and that in itself has never been addressed in our current economic systems either. And yet we can see how much, and teachers included, right, our K through 12 teachers who are not paid particularly well, right, we can see now how crucial all of those folks are in the operation of the economy more generally. And so hopefully this will be a time for us to really take stock of the role of these caregiving industries, right, in our economic systems and how we can value them better. And the other thing is, I think it's interesting how this comes back to these questions of public versus private sphere, right? So I noted that as the pandemic hit, many industries were allowed to continue functioning if they could maintain social distancing, right? So your landscaping services, essential services like plumbers and electricians, but again, my house cleaning service was not allowed to continue operating, right? Even though we could have maintained social distance, right? I could have left the house while they came to clean. So this kind of distinction between what's in the public sphere, right, versus what's happening privately in your home, I think influences some of how policy gets made too, often to the disadvantage of women and people of color.
That's a great point in thinking about when families often think of ways to trim their budget. They think about pulling back on ways that they may have outsourced their laundry, or who was cooking their meals before, or who was cleaning their homes before, or any other function like that. But that then means that there are more labor hours for often that primary caregiver, who happens to be female in many cases within that home. So saying, oh, we're not going to get takeout as much, we're going to eat at home, that doesn't necessarily mean that that's going to be as convenient for everyone who's involved in the family there. Given that, according to some statistics, at least as late as 2018 or so, women were only making about 81.6 cents to each man's dollar. And we must mention too that that does not reply or correspond most accurately to Black women and Latinx women and other populations. And so when we then had the kinds of closures of multiple businesses that had some profound economic effects, especially given that women were often in fields like retail or working as servers in restaurants that were highly impacted by this. So all of those things are really adding to that kind of constriction that many families are feeling there. One option would be that even during this time, some people who were essential workers continued to try to make as best use possible of other means of caring for their children. But Laura will bring us up to date in having us to think about how even before this, many parents were really aware and had concerns about how there were too few childcare opportunities or providers, especially at affordable cost or with sliding scales that could accommodate a number of people. Laura?
Sure. If we focus on the system of early education and care for kids birth to 5, what we had pre-pandemic was what at best I would call a patchwork of a system for kids. And even just focusing on Columbus or Franklin County, parents have many different options to, well, so-called choose from private care providers, nonprofits, for-profits, programs affiliated with public schools. So we had this patchwork of a system that parents had to wade through. And it was very clear that sort of whatever, wherever your need is in society, whether maybe you're a single head of household woman working at very low wages, you have a need for childcare. And then, you have families where both the parents work in the emergency room at Wexner, they have the same need too. In terms of accessibility, all families looking for childcare were having a hard time going into the pandemic. Interestingly, right before the pandemic, at least anecdotally, we seem to have a drop-in need. I heard from, a drop-in need for childcare. At least anecdotally, I heard that a lot of programs weren't having a lot of kids showing up. And I think what happened is our schools closed before our early learning centers did. And so suddenly parents were having to deal with having school-age kids at home. So it might not have made sense to run across town and drop your child off at an early learning center. Then businesses closed, people lost their jobs. And frankly, a lot of parents were getting really nervous about sending their kids off into care with other kids. And so now we're in this sort of netherland where it's a little bit unclear what's happening. There is need, there will be need, there probably will be some diminished need as in after the 2008 recession. But the real challenge is that a number of centers will probably not reopen. Or if they are reopening, it's at a greatly diminished capacity. So we are going to have fewer slots available, which is further going to really constrict the system. And what we don't really have an understanding yet is what is that need going to look like? And are these going to balance each other out? My hunch is no. We're going to have a smaller system still serving a larger number of families than the need is there.
For programs that have that reduced capacity, then I know I've heard from one colleague that the daycare that they use is only accepting children for essential workers and at a 25% capacity. Besides the category of essential worker, what do you think are some other kinds of identifiers or factors that childcare providers will be keeping in mind in trying to determine which families will be given access or not? I could imagine, for example, one might think, well, they have 2 children here, and so I don't want for the 2 children to have to split up, so we will allow this family. What other kinds of decisions might inform that?
This is really tricky. And one of the things that's been difficult for me through the pandemic is really monolithically viewing early learning centers as serving the adult workforce, where I completely understand that that's, you know, a really important function. But another piece of it is there's kids, many kids who really benefit from being in a high quality early learning setting. And so I would have a hunch that at least I operate, I'm responsible for a school, the A. Sophie Rogers School at Ohio State. And we have teachers who are just aching to get a subset of kids back in their classroom to support their needs through this time. So I don't really know how people are gonna sort of triage these decisions. Is it who was there? I really don't know. And it may have to be case by case.
That's a good point in terms of having us to shift our vantage from what it is that the families need in terms of parents needing the service so that they can get back to work, to really thinking about which ones of those students learning might be most impeded were they not given that early access back to some of those childcare facilities. You know, let's continue thinking a little bit more about some of the logistics that go into reopening some of those centers. And here I've asked a couple of you to kind of weigh in to think again about what are leaders thinking about. John, I see already that a question has come in from the audience of someone saying, how feasible is it going to be for K-12 operations going into this fall? And what is going into the kind of decision making that you're thinking about these days?
Well, I think, first of all, we're still very early in the process. When we think that we have 7 or 8 weeks before the start of most public schools, we have to keep in mind that we have just started to open up Ohio. And one of the things that we are monitoring is the data in terms of where are our students. We have constant communication with the Franklin County Public Health Department to talk about where are the cases in our community. But as school leaders, we are planning for a myriad of different challenges as we return to school. Of course, we would love to safely return to school with all of our students every day in an opportunity to be face-to-face with the kids that we serve in our community. The challenge will be, can that be done safely? When you look at restart plans, many of them call for face masks, call for 6-foot social distancing, and maintaining the precautions that every other industry has had as they've reopened. And when we look at that impact on families, if we are only able to have 50% of our students per se in our classrooms at any given time, now you start looking at models and planning for models that could potentially have A days and B days, where 50% of your students may be home while the other 50% are in your classrooms. You look at potential AM and PM models. And then you look at other models, such as what we're doing now is there a way to get all of our elementary students in while potentially having high school students and middle school students be alternate days? When we think about childcare, you think about those youngest students first. As parents, although it wouldn't be our preference, our 7th through 12th graders probably could handle themselves if mom or dad or a single parent had to go to work. And if you were leaving those secondary students home on an alternating day, that's probably something that wouldn't prohibit someone from going to work. But those elementary students, is there a way that we can get them all into our school using spaces like cafeterias, gymnasiums, media centers to achieve the 6-foot social distance, which will be required potentially for them to be safe? At the same time, taking into account what we're able to do with families to fulfill that role of a safe place for children to be during the day. And that's the balance. And at the end of the day, as public school districts, someone has to be supervising the children. And so if it is us with them spread out in our spaces, there's a cost to that. And someone is paying the salaries of the people who are watching the children. And if it's not a model where it's 24 or 25 kids in a classroom, if you only have 12 kids in the classroom, who's watching the other kiddos? Or if we send them home and we alternate days, now we're placing that burden of childcare on the parent on the days that they're not with us. And those are our struggles. And right now, we're very much in that planning stage as we look at what does August and September look like in our public schools.
I could chime in. I just want to note this is a really exceptional thing I find for schools and for the childcare industry, right? Unlike other industries where they can effectively maintain their volume of business by adding extra hours, adding extra days, right? The dentist can stay open for, until 8 p.m. or something like that, right? And workers still only need to come in to do the specified hours, right? With childcare and schooling, we cannot do that, right? There just is no way, given the infrastructure, that we can operate on reduced capacity but still meet all of the need. That's a really unique challenge, I think, where there's a lot of room for policy potentially to step in and address that challenge.
Yes, because if we look at extending our hours to separate the kids more, you still have to have the resources to have the adults in this space with the children. And that doesn't even start to touch on our before school and after school programs. We have a school age childcare program in Hilliard that for our families who are low income families, there's a sliding scale. We can provide childcare from early morning hours all the way through to the dinner hour for families who need us to provide that safe supervision in the child's school. And now when we shut down, that's no longer available too. And when we look at the potential models for that to return, that is also decreased number of children under the supervision of an adult in a space, which again, there's a cost factor that we would need to take into account. If we were going to serve the same number of students, we would need that much additional staff. And as we saw on the front page of the Dispatch today, the state has a almost $2.5 billion hole in the budget. So I don't think additional funds are coming to our public schools to take into account some of these costs associated with how we respond to the virus.
This is a really challenging and precarious situation, as you all are noting. And Noelle, I know that you have dealt with districts before in precarious situations and thinking about kind of crisis and how to follow up as a leader in these kinds of situations. I wondered if you could share a little bit about that. Even if we think about this as being a fairly novel situation, what have we learned from educational leaders before who have faced difficult situations?
Yeah, so thank you for holding this panel. A lot of what we've been talking about with crises and leadership, particularly in schools, there's typically a focus to get back to normal or to have business as usual. And they often center around issues of physical space, which, John has mentioned. How do we get people back in schools safely? But one of the things, particularly from some of my research on schools in crisis and leaders in crisis is that we tend to treat crises as emergency type of situations, and we deal with them as an emergency rather than as a strategic long-term sort of process. And we know that schools are ecologies of their own, right? That have many intricacies of things that they are providing in terms of services, in terms of, so it's not just an instructional place, but yet our crisis sort of management plans in schools, the way we approach bouncing back from these crises don't often match the reality for certain things. The unique thing I think about COVID is a lot of people who have done work on crises or leadership, it's always on the aftermath of the crisis and how we're going to move forward. And with COVID, we're still in the midst of a crisis. It hasn't ended. And so, you know, even my research hasn't actually looked at what are these, how are you trying to get back to normal during an ongoing situation? These are some of the challenges that I think schools are facing. So, you know, in addition, when we were talking just kind of earlier, schools provide a lot of different services that matter to the health and well-being of the people that are in them, such as school community health clinics. Those kinds of services. I think John mentioned after school care, where the school actually becomes a sort of vital partner in caregiving type situations. Those things have ended and will probably continue, right? They're also in the middle of crises. So yeah, you know, I can go on and on and on about this issue, but you know, the uniqueness is the ongoing nature of the crisis right now.
Yeah, I think that is what makes this differ from something like Hurricane Katrina, where it was a kind of fixed period of time that the actual storm was happening. And then people were like, it's over, we can rebuild or first clean and do those things. But when there's the possibility of even additional outbreaks in the fall when we return to work or to school, it's difficult to continue navigating that. About the intersection that you're making here. We've often heard in the news about how schools were trying to do free lunch programs and thinking about how to mobilize those as we move to virtual academies. But you really brought out that additional point of the healthcare intervention that a lot of schools provide for students as well, so that some students may be disadvantaged without getting some of that early detection or intervention that ordinarily comes from a school nurse or even a very attentive coach or so on. So thanks again for kind of highlighting that. You know, as we talk about these things together, it seems that whether you are the parent and guardian or you are the leader and administrator, you're going to have to take together different research from studies about medicine and public health and infectious disease, also about child psychology, learning patterns. You have to take the economy in mind. And then too, there are these kinds of ethical dilemmas that we're also gesturing to of simply, does it feel like a good idea or not? Does it seem like a kind of safe idea or not? About a month or so ago, Working Mother magazine had an article that was trying to help people to rank the different options of thinking about, okay, is it safer to bring a babysitter into your home or to send your one child into the babysitter's home, and to do a kind of ranking there. And so I'll just share that from their own order, the kind of low to high risk they were thinking about is that there was lower risk for bringing in a sitter or a nanny. And then next of sharing a sitter with a family that's nearby. And then the risk starts to escalate a bit, but only slightly when you're sending kids to a small in-home daycare. opposed to seeing the size and capacity of that lift up. In fact, one of the contributors to this piece from Working Mother was our own Kathy Lancaster from here in public health at Ohio State. And she mentions that at this time, it might be more, it might be wiser to think about doing things with your kids that are parks or walking trails, and hold off just a bit on some of the usual things that we're used to for popular summer kids options. However, all of these recommendations, as even Lancaster notes, are tentative because we just don't know enough about the virus yet. And so we're going to be looking out for additional studies that can help a little bit more. Maybe based on either your own experiences or other conversations that you're having with people, how are you hearing that parents are weighing some of these decisions about whether to send their children to camp or not? Or even differently, whether to allow for grandparents who might now be considered in high-risk categories to play a caregiving role for those families. What are you all hearing or maybe even recommending?
I think there's a mix of feelings in our community. We just did a survey with Fallon Research where we asked our community, how comfortable are you with the way Ohio is opening up? And 77% of the Hilliard community think we're opening up either too fast or at the right pace. It was about 23% that said we're opening up too fast, and a little bit above 50% that says we're opening up at the right pace. But that's not the behavior that you see in public. We see kids on the soccer fields, kids at their little league, kids out in public. It seems that we are opening up faster than we think we should, but we're all kind of contributing to that kind of opening up pace ourselves. And we asked our parents if they thought we should come back to school all as normal or with a modified schedule, and it was evenly divided. It's one of those kind of no-win when you're the superintendent. It was 47% think we should come back all in, operate schools with everyone there, and 42% said, no, you should open up with 50% of your population. And then the rest was undecided. There's a real divide, Andrea, in I think how our communities are responding to this. And I'm also not sure that people's thought process always matches their behavior, because there's a natural inclination to try to go back to normal. And we use that term, and Governor DeWine has said multiple times, at least in our field, when we return to school, it's not going to be quote unquote normal. It's going to look very different. And that's hard for us to conceptualize because we just don't know what that is at this time.
Right. And you were mentioning earlier about how that might mean socially distanced and smaller classes. Smaller classes are often something that many educators and parents have often been pushing towards, but as you say, without the kinds of financial support to be able to do that, it's harder to carry that out. Noah, would you like to add here in kind of thinking about what you're hearing from parents or how you hear people making decisions about how to allow their kids to engage, interact with grandparents, play with the kids next door or not?
Sure, certainly. I mean, I think I want to speak from university employees who I have working in my office, who this issue is really precarious, to use your word, Andrea, for them about whether to actually send their children back to school, their own health, maintaining a health for themselves so they can be able to take care of their children is a very big concern. Many people on the campus probably know that the Faculty Senate actually had a survey that they sent out to all different kinds of employees. Yeah, there's just as John said, there's a real sort of sense of still this fear around actually risking their own health and the health of their children but actually what happens when the university opens back up, and they may or may not be required to come back to work.
In our own survey from the Women's Place, we found that of staff respondents, 87% of the female staff respondents to our survey said that even when the university returns to full operationality, they would prefer the option of working from home. And that might vary from 1 to 2 days a week to match the kind of oscillating schedule that you all are thinking about, John, is one possibility, to other more sustained opportunities, especially to deal with either their own chronic illness or those for students there. So those are some kinds of things that we'll need to keep in consideration. And you're both highlighting the ways that people may put into practice something out of immediacy, and for the sake of expediency, even differently than they had in mind as a kind of ideal there. One option that comes in that regard is thinking about babysitters, or someone perhaps locally who might be able to fill the gap that's left by professionalized childcare. And yet I appreciated Joyce's statements earlier in our conversation about how many care providers already were paid minimally. To make sure that in creating any kinds of contracts with babysitters, professional or not, that we don't undercut that market. Joyce and others of you too, any suggestions of how we could make sure that we're coming up with fair or equitable practices for even employing people informally for childcare during this time?
Yeah, that's been a really an issue that's really been troubling me, and I've certainly been guilty of it, right? Of hiring, you know, my neighbor's daughter to babysit my kids for very little money, when really there's nothing else that is more important to me, right? If I had to pay for my children's health and safety, that's what I would pay the most for, of anything else. But the market somehow is not structured to sustain those kinds of wages for caregivers. And so I think some of that is in part because employers in the past have been able to really treat childcare as a private problem, right? As something that each employee can secure or must secure on their own. And now during this crisis, we've seen that that's just not realistic, right? It's now actually impossible, right? However, I might wish to allocate my time to work versus childcare, I no longer can make those choices. And so I think it would be a good time for employers to reassess how they can support the caregiving roles that folks need to be able to do their jobs, right? And I'll just add, as part of that, right, is not only the, you know, can I go to the office? It's, you know, how could I possibly do the same amount of work that I used to do when, you know, I have my kids home half the time, or I have to check on their schoolwork, keep them off of, you know, screens, all these different issues. And so I think that's another area where employers really need to think about caregiving in a broader perspective as something that contributes to the public good of their operations, right? And not as a private problem just for individuals to deal with.
And indeed, we're seeing comments come in from the audience of saying, yes, flexibility is great and awesome, but you're exactly right about the challenges having children at different ages, for example, who have different kinds of needs for at-home schooling. Noelle?
Yeah, no, I appreciated what Joyce had to say just about how employers can support. I have a friend in Alabama who's a VP of a company, and something they've been considering is actually giving small microloans to their employees to, do you need to get a babysitter to be in this all-day workshop, or do you need to just trying to be really creative around the solutions that they're offering employees to be able to do this. And so I thought that was just a neat idea around some of the work that needs to occur, but a different type of support maybe than I think most organizations think about offering.
Right. I think actually that was one of the kinds of anecdotes that I've been thinking about is perhaps a parent is used to allowing for their kid to stay with a grandparent during the summer in another state. And now the idea of travel between states and of having this kid with your parent who may have pre-existing conditions doesn't seem as advisable, but yet you haven't put aside the money for childcare. And so that's when different employee emergency grants and so on, as this company is modeling, could really be a kind of benefit there. You know, much of the conversation thus far has been largely focused on childcare, but we do want to recognize that the caregiving responsibilities that many people have here at the university and elsewhere are also for individuals with special needs of all ages, as well as elder care, especially in the area of dementia. So Kelsey was kind enough to join us today and be able to share a little more about the elder care kinds of opportunities or resources that are available. I think especially because this topic is probably less well known by a lot of Ohio State employees about their benefits, about how they can use family medical leave to take care of an elder for periods of time. And so Kelsey, we'd love to have you jump in now and share a little bit.
Well, and several of you have mentioned items that are already affecting my families. You know, through the Employee Assistance Program, it's a wonderful benefit and allows families to have consultation. And really what we do is help guide them along these continuums and these journeys, these caregiving journeys. And now the journeys are so different, right? This is not something that most people know what to do. And these families are so blended now because of exactly what everyone's describing. Now we have children at home, and maybe grandparents were taking care of children before, and our grandparents do have some health, compromises that we need to be very mindful of. And so families now, it was interesting, right in the very beginning of March, the phones stopped ringing, which is really remarkable because we teach people to reach out, right? And I'm a caregiver, so I teach my caregivers to reach out for help. And it was remarkable that they stopped calling for help and they went internally. They were trying to figure it all out on their own and turning to friends or struggling. And then about a month later, everyone started to call because many things started to happen. Their parents maybe were having to move in with them. They maybe were no longer able to use their grandparents for childcare as it was before. Their parents could not go to an assisted living without being quarantined for several weeks, which was not something that they wanted to endure. They had a pre-existing condition like dementia, which is my area of expertise. And they were really struggling. What do we do for our folks our parents who have these cognitive disorders and they can't understand what's going on and we can't direct them, right? We can't say to mom, stop touching your face or wash your hands or don't touch one another or don't hug me when I come by because they can't comprehend that, right? So many other types of stressors were happening and are continuing to happen. But I think now most of my clients are starting to kind of get the gist of it, right? They're understanding, they're being creative, but now with the whole childcare issue and returning to school, this is raising some additional challenges because maybe they did make this decision now to have their parents stay at home because they're working from home and now they may be returning to work and they are just overwhelmed as to what to do. And do I bring in a home care company? Do I bring in a professional service? And how do I trust that they're taking the precautions? And how do I trust that they're not going to bring in an illness, and impact my family? So there's just so many layers that go on with all these families. This is not something I could say, oh, here's coronavirus 101. This is what we do, right? It's so different for every single family. So, some of the resources and what I always advise people to get familiar with is always your area agency on aging. And every county has a dedicated area agency on aging, and Franklin County is a very good area agency on aging. I refer people there quite often. And they are really the hub of resources. So they're going to educate and also make families familiar about new communications from the state and from Centers for Medicaid and Medicare that roll out a lot of these new guidelines. I get a new rollout every day. I mean, there's a new rule or regulation every single day. And so you're trying to educate compromised folks, but also their families who are juggling so much. So I would always say area agencies on aging, but also their healthcare providers. So if they maybe are seeing a neurologist, right? Maybe they have somebody who has Parkinson's or Huntington's disease or dementias. Many times that provider has a social worker on staff that can help direct their care. So they're not just going in there for their medication or for their checkup, which is also very challenging to do right now. So they're doing a lot of telehealth now, and telehealth has become very, very popular. And I'll tell you, a lot of my families love it because they don't have to transport their compromised person to the doctor, which is so challenging. So it's wonderful to have the telehealth. You know, they can bring the person, you know, in front of there, and the practitioner, the provider can talk to the person, the caregivee, if necessary. So that is one option. There's a lot of other disease-specific nonprofits that are available that have a lot of online tools, like the Alzheimer's Association, like I said, Parkinson's, you know, a number of different cancer support organizations, MS. So they have a lot of online tools and virtual programs. They have webinars. They have coaching like what I do a lot. I'm doing much more Zoom coaching with my families. Before, when I was just doing telephonic, people want to see me now, which is really nice for me to be able to see people and work with people that way. So, you know, getting familiar with some of these resources. So that's really a lot of what I do, is educate them and make sure they know who to turn to. I'm doing check-ins with people every week right now. So that is not something traditionally I have seen. Many times people will call me once or twice and, you know, get their needs met and then move on and they know what to do. Now they want to talk to me every week or every other week and just make sure. So it's again, wonderful benefit to have the EAP because they've got someone that can kind of walk along this whole path as they move forward with some of the issues that all of you are bringing up.
That's great to be able to talk more about those kinds of benefits through EAP. And two, as you were saying, a lot of local organizations can offer webinars and so on. I think multiple industries have gotten hooked necessarily on Zoom and the kind of convenience of being able to convey information to people often across distances. Your point about telehealth also reminds us of the ways that insurance companies have had to respond differently in acknowledging the different ways that people can receive treatment during this time. And so we do know that these big corporations and institutions can be nimble when necessary, and you're bringing up some other great examples of ways that that can continue to happen. You know, as another element of thinking about community resources, especially for individuals, for people who are caring for individuals for special needs, I'd especially like to bring attention to an organization that has some connections with another Ohio State person. The Mothership is the name of a kind of local nonprofit that's especially interested in making sure that people who are caregivers for special needs children and individuals receive the kind of care that they themselves will need. And so the Mothership, and Emmy Trendy has mentioned this to me recently as a founder who works right there on Ohio State campus, and that this organization actually funds house care cleaning for some people. It can assist you in making the time and having the social connections for date nights or friend nights with parents. And it's also available for caregivers of multiple genders who can seek assistance through this. So I encourage you to look up other websites like that that could be useful as well. The last thing I'd like to say and have us to talk about elder care, Kelsey, is that a lot of people are trying to distance themselves maybe from their parents or grandparents, or the nursing homes have been closed down during this time. What kinds of advice or recommendation or models have you seen for people keeping in touch with their elders?
Yeah, and unfortunately, that's how our country became familiar with it, right? Is what happened out in Seattle. So we watched that, witnessed that, and we've seen this roll across the country and see what's happening with people. So senior living communities are broken up into a lot of different types of care. So you have independent living, you have assisted living, you have memory care, you have nursing homes. All of them have their own kind of regulatory guidelines. So each one of them, from an assisted living and an independent living, is going to look much different than a nursing home. However, they're all following very similar guidelines, reducing the amount of physical contact. So we're seeing a lot of creativity about how are families able to at least have time with their loved ones. So in Cleveland, where I'm at, we see a lot of caravans, which is remarkable. You get 30 or 40 families that are all in their cars and they're driving by the residents, and they're letting the residents know to make sure that you're at your window at that time. Now that the weather's improved, they can at least go outside, but they have limited exposure. So some of the other creativities, which I'm sure some of you have also seen, that there's ways that maybe they're allowing people to hug, and they use some of these full masks and bodysuits, and they're plastic, so that they can at least hug one another. All of the caregivers are masked, gloved. This entire staff is. They've had a lot of reductions in staffing, so that speaks to a lot of what you all have been talking about too. I mean, the challenges of staffing in this industry are so great to begin with. There's such a shortage of caregivers, and when we see these surges of elder care communities being built, and they're all pulling from the same caregiver pools. There's just such a limited resource there. So we're tapping into those, and those individuals are exactly what Joyce was mentioning, is that those are the folks that are getting paid minimum wage, doing some of the most challenging jobs, and they're having to stay at home to take care of their children because they can't afford daycare. But then again, there wasn't daycare available. So it's really stressful in this industry. So the care that's being provided, there are definitely, I'm hearing a lot of that from families, that the care, the amount of care, the quality and the quantity of care has been challenging. So some of those decisions about moving into senior livings, maybe people are making, they're a little bit reluctant right now to do so. So when they go into communities, I would say, reduce the amount of times that you're going in, because every time we go in, we risk maybe bringing in some germs, some infection. And, they're all taking temperatures and so forth, but we also know that's no guarantee. So I would say limit your exposure, increase your virtual experience with your loved one, right? I think every community now is teaching everybody how to FaceTime, how to be involved with their computers. They have staff now that's dedicated to families that go room to room, allow them to have conversations with friends and loved ones, scheduling those times to have those virtual visits, maybe outside a window, or at a safe distance outside. Now that we're seeing some of that, some of the assisted livings and nursing homes are now allowing people in, but they're pretty scrutinous about when they allow them in and what they're allowing them to do. And we'll see more of that over the next month or so, but we've got to keep an eye on things right now. Because just like John said, people are very anxious. They want to get started. They want to start to visit again, but we have to use a lot of caution, especially because the elderly are at such a greater risk at contracting the illness, and also, having some higher mortality. So we really, really have to be very careful with this population.
Exactly. Well, we've been talking with many leaders here on the call of people who are making decisions for childcare or public schools. We've also been talking, and Noel was bringing up the kinds of decisions that also influence leaders in crisis there. We've commented a bit on some kinds of policies that can help, but sometimes everyday colleagues and friends also like to know what is it that they could help to do to support the caregivers during this time. So especially here at Ohio State, we often think about the importance of parental leave and having those policies on the books, but it's often at the level of the department chair or the staff supervisor or the colleague in scheduling a meeting that they could do something that would better support people on campus who are parents. I wondered if some of you could talk a little bit about that. What can professors be doing for their students who are student parents? I know I've had a student before who said, my kid's school is closed for a snow day, and yet I still wanted to come to class. Can I bring my child with a book to sit at the back of the class? And I checked the minors policy on campus and found out that policy, which often refers to camps and athletic programs for youth on campus, does not apply to having your kid on campus. That is permissible under emergency circumstances. And so I said, sure, let them learn about African American literature, which I teach. It's never too early for that. But what are some other ways that people can be supportive of student parents or colleagues who are parents doing this as either professors, employers, colleagues?
I'm really glad you brought up the matter of college student parents who have for many years been completely ignored, and the stories that you hear from student parents, many who are single women, Pell eligible, their experiences are really tough, and we have a lot of barriers on campus that really impede their development. And so you just piqued for me the reality that things are going to be harder in the fall because many of these parents may have lost childcare resources. So I think the time is now that we have to very, very seriously entertain drop-in childcare on our campus. It's an idea that's been circulating. We've sought funding for it a couple times and haven't been successful. But that would be a very good solution that we could probably get up and running pretty quickly. So, you know, anyone who's interested in this, we should talk offline. I know, for instance, the Schoenbaum Family Center, we are only open during the day, so we would have a facility open in the evening as an option. But that is one option, and I applaud you for inviting children into your classroom, and I'm really glad you represented that the minors policy does not prohibit that from happening.
Correct. Yes. Others in being supportive, Noel?
Andrea, I'm glad you brought up policies and procedures, even though I know your question was something else. But, you know, one of the things we see in crises is that the policies and procedures have not caught up with the level of what is actually happening on the ground. And sometimes these policies and procedures actually provide barriers to some of these solutions that we've been trying to talk about. So things like, you know, flexible work leave, there are certain stipulations even around flexible work leave or work sharing, that there are certain policies around work sharing. You have to meet certain criteria. And so, you know, that is just one thing that I'm always looking at around different things that happen like this. Even our contingency plans or our crisis plans or our emergency plans don't actually, have not actually caught up to the level of what's actually happening during a crisis. You know, and the other thing is organizations are still really reluctant to admit to the undue burden on certain populations around crises. You know, even though there's lots of research, many of you have talked about a lot of research that actually impacts caregiving and women, and organizations are still just kind of reluctant to change their practices and policies to accommodate what many years of research has already been telling us. And so, you know, in thinking about what types of responses can be made, I think this is a moment, not just for OSU, but for many organizations, is their espoused values around support for employees, around support for students is actually going to be put to the test. It actually is being put to the test. And so things like these flexible work arrangements, creativity around work and learning arrangements is going to be absolutely key. And I'm so glad that Kelsey is on here too, because, you know, we get these emails that have, you know, here is where you can click on this link to go have support and so on and so on. And those types of supports that we're actually linking people to are still very limited in their scope and very limited to the actual things that they're providing for people. So yeah, those are just my 2 cents on that.
Great. Sean?
I think in any crisis, there's opportunity to get better. And when we go through crisis situations, once we get our feet on the ground, and I know we've talked about looking back, if you listen to the experts, we're still in the first half of this. We don't have time to wait for the research. We have to respond to the challenges that are in front of us now. And how can we get better? And one of the things we've been fairly good at public schools, because historically, many of our teachers have been moms, is, are there opportunities on professional days? Are there opportunities in the summer where teachers' kids are running around the school because it's what teachers have done? Is that a model that we can look at differently? And my only caution is, in a global pandemic caused by a virus, we also have to know the exposure that if you bring your kid to work, what position are you putting your child in? And we talk a lot about your circle, who's in your circle. So as we look at, and when we've had some tough conversations already with our staff, if we were to go alternating days, many of our teachers live in the Hilliard community. Many of our teachers have children in our schools. What does the care for those children look like on alternating days? So those are things that I think we have an opportunity to be better. And can we all look at those policies, those practices? And some of those practices are historical, like it's how we've always done it. And how do we expand that? Are there ways to make that better? So I think we always have a chance, and we say every day, we want to be better today than we were yesterday, and we're going to even be better tomorrow. And how do you reflect and have that mindset as you go forward? So I think that's our challenge, is to be better.
Yeah. Joyce?
I think that's one of the really unique features of this crisis, is that it's a sort of indeterminate length, right? Many of us feel like we could cope with a short-term crisis, right? So when schools first closed, it felt like, oh, I can do this for a couple weeks, and then, okay, I could probably do this for a couple months, right? And then we also know how to deal with longer crises, right? Like if I could never send my kids to childcare, I would go part-time or find a different job, right? But this indeterminate length means that it's very hard to identify the right approach for this time period, right? And similarly, maybe Kelsey can address this. I sort of feel like employee assistance programs are designed around those two ends of the spectrum as well, right? A long-term adjustment or a short-term Band-Aid, but nothing for this sort of in-between that we're in now, right? Where everybody's uncertain and we don't really know how to address that. I do think, privately, what I would suggest is for those of us who have the capacity, I think using more formal outlets for childcare, like care.com, or some of those other resources where, providers are licensed and background checked, right, and registered and everything, would be a good way to help support those caregivers, as opposed to going with the informal arrangements that, I know are appealing for many reasons, right? They know your kids already, or your elders already. But it does detract, I think, from those who are trying to operate formally, and who can get higher wages by doing so.
Great. Let's turn here to a few more questions from the audience. And again, we've been integrating some into our conversation already, but we have a particular question about how to get children to shift from the mindset of quarantine mode, of staying away from people, to maybe returning to school and being in school mode, where they will be in closer quarters with people. And some parents are worried about the kind of anxiety that children might have about this, certain phobias around germs and so on as a result of this. What kinds of advice can you give for parents in dealing with their children, and guiding their children's emotional sense of well-being during this time as they move from quarantine mode to the possibility of returning to school?
Well, I think as we face students back to school, we have to pre-engage with parents so that it's a similar message that we're giving and that parents are giving. And then our teachers have to be ready to have these conversations when our students come back. Part of this is going to depend on how we come back. If we come back in a phased-in model where it's not everyone and we have smaller groups, those are different conversations. One of our biggest challenges, and I'm just going to be plain honest, is going to be masks. And we have some families who discard what some health officials say, and we have other families who live by what other health officials say. And one of the biggest challenges public education is going to face is if the return to school is predicated on students wearing masks, what's the response going to be when a kid refuses to wear a mask or is unable to wear a mask? And that starts in the home. So once we know specifically what our guidelines are going to be, and I suspect at universities there are going to be similar challenges as we look at, are we asking our students to wear masks in the public setting as part of it's my responsibility to keep you safe message. And we're going to have to find some way to be consistent. And from our youngest students to middle schoolers who are just generally crazy, if you have kids in that 6th, 7th, and 8th grade range, and then you look at our high school students, can we have consistent messaging and can we agree on why we're doing what we're doing? And that's the education piece. So the first thing we have to do is find out how we're going to come back. And then we've got to begin the messaging and the education part. When kids come back, there's going to be anxiety for all of us. We have 140 teachers in Hilliard who say they would rather be online teachers than come back because of health issues for them. So there's going to be a level of anxiety. How do we educate and comfort and do all the steps we can? Because we know it goes back to Maslow 101. If our kids aren't comfortable, if they aren't warm, safe, loved, fed, and they're not anxious, they're not going to learn to their highest capacity. So this is going to be more important when we come back right off the bat than the AEIOU. It's how are we going to do school to keep you safe?
So kind of building a safe zone for those students emotionally to even have the capacity to be able to learn new information, even for the unruly ages, as you might say.
Yes, and
there.
And it's not a topic for this conversation. We're going to have 2 conversations we have to have our teachers prepared for when we return to school. We're going to have the uncertainty with COVID, and then we have to be ready to come back to have the conversation about race and equity and justice in our classrooms. And we will not have seen our kids since March. And some of these kids will have had both of these conversations at home. Some of these kids may not have had any of these conversations when they walk in our doors. And whether it's 12 kids in a room or 24 kids in a room, as educators, we are required to be able to have these conversations with kids of all ages. So the challenge is immense. And in addition to planning for COVID and those tough conversations, we're going to have to be prepared for an America that will have changed since our students left.
Yeah, this is a really transformative summer and spring altogether to be able to think about this together.
We've got potentially two once in career conversations at the same time that as educators, we've got to be prepared for. And in our case in Hilliard, August 20th is that date with a star on it. And how do we get everyone ready to embrace those challenges when our kids come back in our classrooms?
Exactly, exactly. Even before then, the kinds of issues that you all are bringing up about space informs another one of the questions from the audience that says that as a number of spaces are inaccessible, and we know even we at Ohio State have often been limited to go to our office to retrieve different things, what kind of workspace can be made available when childcare may be available, so that may or may not be available, so that children can be left alone for a few hours? What kinds of workspaces could be good either for you to be there with your child or to allow for children to be left alone for a couple of hours? So think about the ways that it used to be you would see a couple of parents with their kids after school at the library. The child is doing homework and the parent can concentrate on something else, maybe with their laptop actually working remotely. But now that shared space of being at the library isn't as open in the ways that used to be. What other workspaces might work?
I mean, I think just some conversations, I'm not a parent myself, but just many different folks, even sort of family sharing, if Joyce has children and she might be able to take some of the other children, all these different sort of flexible parenting type of options. I know that people have been talking about that. So that might be one thing. The other thing that we're thinking about, just even in our college, is, do we now go to a closed door policy, right? Where we're trying to sort of shield certain spaces from a lot of traffic and different things like that, so that if you did bring your children to work, or even if you yourself are nervous about sickness, what might that look like, and you actually still be able to provide the services that your office is known for.
Great. One final question, and maybe this takes us back to John's final comments too, that we have from the audience, is just asking us again to emphasize the impacts of the caregiving crisis on the most vulnerable groups of women and families, including single parents. So I'll open this up more generally. Laura, I know you are also starting to speak about that in relationship to student parents. So how are all of the things that we've been addressing somewhat exacerbated for more vulnerable or less financially secure families?
That's a hard question to answer, because I feel it's really bad for a lot of our families. Our families who are already teetering on the margins, unable to have decent wages in this community, unable to have quality care for their young kids, unable to feel safe and secure in their neighborhoods. That was pre-pandemic. And so, you know, I get really nervous about a path forward that is going to be sustainable, helpful to our communities. And, you know, frankly, we're going to just have to be incredibly aggressive. And it's hard to do that over Zoom with a $2 billion deficit. And so, you know, I do remain hopeful, but it's going to be a long haul, and I'm really worried about the vulnerable in our community.
You know, at the same time that we think about the ways that we might be, many of the situations have been exacerbated for more vulnerable families. We also today have been able to share a number of different resources that I hope that our audiences will be able to call on. And so it's with that that we want to, again, thank all of our panelists just for being able to join us today and share these resources, ideas, as well as quandaries, knowing that we're in this together and making sure that both children, elders, and those who love and care for them are doing their best. Be well. Thank you.